This is our daily live show called Live with Faye, where we take up issues that are of national importance. Now, there has been a sort of battle going on between the state government and the media in Gujarat. And there's a reason behind this. The media has been reporting numbers that are completely different from what the state government is quoting as its official COVID numbers. Just to give you some idea, and there is a very detailed report about this on Scroll, you can take a look at it, but there are many other organizations that have written about it as well. In Ahmedabad, for example, the government has listed 20 deaths on the 12th of April. But a leading Gujarati newspaper called Sandesh has claimed 63 people have died in just one government hospital. And this newspaper apparently stationed a reporter outside the morgue to just simply count bodies. The state government also claimed there were 0 deaths in Jamnagar, whereas local media are saying that over 100 people have died in 48 hours in Jamnagar. And the reports are similar for Vadodara, for Surat, for Ahmedabad. And there is reports of shortage of beds and several other problems coming out of these cities as well. It does seem to be a very serious problem. To help us understand what's going on the ground right now, I'm joined by a senior journalist, Mahesh Langa, who is the senior assistant editor at The Hindu, the newspaper, who joins me right now. Mahesh, good evening. Thank you for joining us. Between what the state government is reporting, which is 67 deaths in the last 24 hours, how far away from the truth is that, and why does the media feel that the government is not being accurate, Mahesh?
Well, we just received the government's health bulletin for today, and that states that there are 73 deaths in last 24 hours and almost 7,500 cases. Yesterday there were 6,700 cases and 67 deaths. So there is a pattern in the government's health bulletin that is giving out to to the media that they normally give 1% of the deaths, 1% of the total cases. So there were 6,700 cases yesterday and 67 deaths. Today there are 73 deaths and 7,400 cases. Okay, so there is a mismatch in the figures that are given to the media by the government, and the way media is reporting from places like Surat, from Vadodara, Jamnagar, Rajkot, even Ahmedabad, and the figures that mainstream media in Gujarat is quoting are mostly from main cities like Surat, Jamnagar, Rajkot, Vadodara. We don't even know the extent of deaths that may be occurring in rural rural parts of the state and remote districts. So in that way, it's quite a grim situation. Today, Sandesh reported that on Monday there were 55 deaths as per the government health bulletin, but actually as per the COVID norms, almost 500 bodies were disposed of. So that's the that's the extent of mismatch between the government data and the data that is coming, that is being reported by the media from the field.
Mahesh, our understanding is that last week Chief Minister Vijay Rupani had spoken about this, and he basically said that Gujarat follows guidelines of the Indian Council for Medical Research, which is the ICMR, which is that if someone who has COVID dies of a heart attack, it's listed as cause of death heart attack and not cause of death COVID. Is that the reason why there is a mismatch?
Well, that's what appears to be the reason, because the government has constituted death audit committees in most of the hospitals at district and city level. And that death audit committee determines the cause of the death. So our understanding on the field is that the government is not including those who die of COVID, but who have comorbidities as COVID death, and that seems to be the main factor. That's why there is a lower number of deaths as per the government data.
There are also very distressing stories coming out of Gujarat of crematoriums that are overrun. Basically, the lack of space in burial grounds, the lack of space in crematoriums. Could you give us an idea firsthand from the ground what the situation is like?
Well, talking about Surat, it's very, very grim situation. The municipal corporation there started using, three crematoriums, kind of, which were in disuse for almost a decade. So that shows the kind of things that are kind of situation that's there in the city. So as per local media and even local officials, the city is witnessing almost around 200 deaths per day. So it's a very, very very, very alarming situations. Same thing is in Rajkot, that as per local media today, there were 55 deaths in the city. In Jamnagar, there were 30 deaths in the city. In Vadodara, almost more than 50 deaths in the city. So it's very, very, a very extremely bad situation prevailing in main cities of the state.
And what is the situation right now on the availability of beds?
Well, to be fair to the government, they have been increasing bed capacities in the cities. They have got private hospitals. They have even got smaller nursing homes to start treating COVID patients. The problem is that I think government also did not anticipate the ferocity of the second wave, and that is where the even medical fraternity, government authorities, and even people at large also, they were caught kind of completely of this thing. And the way this pandemic has attacked, sheer ferocity of the second wave is actually that has caught the government napping, government as well as civil society and medical fraternity and other and people at large.
So at this point, so obviously the concern for us would be that if the government is underplaying the numbers, as is being reported by most of the media, that there is a reluctance to sort of maybe accept the gravity of the situation. And accepting the gravity of the situation would be the first step to solving the problem. Is that what's happening on the ground?
Well, yes, ideally, yes, government should accept the reality and show the real figures. But the officials say that that will unnecessarily create panic among the people, and probably that's the reason that government is kind of just giving the figures which are I mean, giving the figures of only those who die of COVID without any comorbidity as COVID deaths, and those who and others who die of COVID but have comorbidities are not excluded in the government figures.
Well, given the fact that we are at 1,000 now, Mahesh, across the country, 1,000 deaths were reported in the last 24 hours. If the state of Gujarat, if their numbers are so far off the mark, then it's likely to actually, the total number is also likely to be completely off the mark as well, right?
Total number of deaths, right?
Or yes, the nation's number of deaths as well. Yeah.
Oh yes, I think that's being what is happening in Gujarat is mostly being replicated in major cities across the country. If you have seen the paper, local newspaper report from Bhopal or from Indore or from Lucknow, it's or Chhattisgarh, Raipur in Chhattisgarh or Ranchi in Jharkhand. So it's more or less happening across the country that true figures of deaths are not coming in.
It's actually a really distressing point to be in, because there's also we also know that the state government has not called for a lockdown. There's just a sort of night curfew that's on right now. And simply first time from looking at what's going on outside your house or outside your office on the street, are people following COVID appropriate behavior, Mahesh?
Well, I don't think so, because there is reluctance on the part of the government to go for a blanket lockdown, because as government has argued in the High Court that lockdown brings in other miseries like economic miseries. There will be issues of shelter of migrants, food for daily wages and migrants. So it will cause other problems, and officials in the government believe that that will only distract the state from completely focusing on tackling the pandemic. Okay. On the COVID appropriate behavior, I don't think that's happening, because still, though in Ahmedabad in last few days, traffic has gone down substantially. People are not venturing out much. But if you go on the street, in the shops, in the market, still people don't wear masks properly. There is a lot, there is much left to be desired in terms of COVID appropriate behavior. So I don't think that's and then I wouldn't blame the government also for that, because we people at large are largely responsible for not following the protocol.
All right, Manish, thank you so much for speaking with us and sharing details on the ground from Gujarat. I also want to, at this point, applaud and thank the journalists in Gujarat for the work that you all are doing. Obviously, against all odds, bringing out the truth for the rest of the country to know, and for the people who have lost their loved ones in Gujarat. Thank you so much for the work you do, Manish, and the rest of your colleagues. Thanks for speaking with us.